Today I have with me a needle and thread, and we will be mending this torn dress while I discuss GAD. Hi, my name is Rose. Let's discuss. So in my last video, I talked about what anxiety disorder generally means as a topic and a body. Today, let's pick the first type of anxiety disorder on my list, and that's GAD, known as Generalized Anxiety Disorder. You can also call it GAD. We have different types of anxiety disorders, but let's dive into GAD, Generalized Anxiety Disorder. GAD is a common type of anxiety disorder characterized by excessive worry about a variety of things, even when there is no apparent reason to worry. For example, someone with GAD might worry excessively about finances, health, or relationships, even when things are going well. Now, let's break it down. I'll be dividing it according to a DSM-IV-TR, which means Diagnostic and Statistical Manual, 4th edition, American Association 2000, from the book Casebook and Abnormal Psychology. It is defined by the following features. Number 1. The person experiences anxiety and worry about a number of events or activities, such as work or school performances, and this occurs more days than not for at least 6 months, which means this happens most days of the week for at least half a year. Number 2. The person finds it difficult to control the worry. And number 3. The anxiety and worry are associated with 3 or more of the following symptoms, and they are restlessness or feeling keyed up on the edge, being easily fatigued, difficulty concentrating or mind going blank, irritability, muscle tension, and sleep disturbance. Also to note that these symptoms will cause the person considerable distress or lifestyle interference. Let's talk about some of the important things you need to know about people with GAD. Unlike people with panic disorder who might feel their heart race or have trouble catching their breath, researchers found that patients with GAD worry quietly inside with tight muscles and grumpiness or irritability. Scientists call them autonomic restrictors or body holders because their bodies holding these scary feelings instead of showing them outwardly. For instance, someone with GAD might be crossing the street, constantly looking both ways, worried a car might come out of nowhere. This is unlike someone with panic disorder who might experience a racing heart and shakiness during public speaking, fearing they will mess up. Also, imagine someone with GAD at a party. They might be worried the whole time, but they won't have a panic attack. They might just be super quiet and keep checking their phone, wishing they were somewhere else. This is different from someone with panic disorder who might actually avoid parties altogether because they're so scared of having an anxiety attack. People with GAD are hypervigilant. They are always on high alert for danger, even in everyday situations. They are more worried about things going wrong than people with other anxiety problems who might have specific fears. Unlike panic attacks, their worry is more general and covers everything, not just one thing. For example, someone with GAD might feel tense or restless at a movie, even a comedy. They keep checking their watch and worrying they will miss something important at home. A cardinal feature of GAD is that people with GAD always think bad things are more likely to happen than good things, even in normal situations. For example, someone with GAD might be giving a presentation at work. They might imagine the audience laughing at them or thinking they are incompetent, even though this is unlikely to happen. They often worry a lot, even about things that probably won't happen. This is called free-floating anxiety. It's like feeling nervous or scared for no real reason. 2 basic anxiety-producing thoughts you need to know. 1. Probability overestimation, which means overestimating the likelihood of negative or harmful events. Probability overestimation is basically like overthinking bad things and making them seem way more likely to happen than they really are. For instance, you might worry you will completely forget everything you read or fail your test, but in reality, you have probably studied and there's a good chance you will do just fine. And 2. Catastrophic thinking, which involves the perception that if a negative event were to occur, it would become catastrophic or beyond the person's ability to cope. Catastrophic thinking is like assuming the worst possible outcome and blowing it way out of proportion. So let's imagine you forgot your lunch at home. With catastrophic thinking, you might worry that your whole day is ruined, but in reality, you could probably grab something small from a nearby store. Now, people with GAD, Generalized Anxiety Disorder, often get stuck in these thought patterns. They don't stop to check if their worries are realistic and they just keep imagining the worst. If you're struggling with Generalized Anxiety Disorder, you're not alone. In fact, it affects approximately 3.1% of the global population. The consequences and effects. GAD can have serious consequences on daily life, relationships, and overall well-being. It can lead to impaired daily functioning and relationships, decreased productivity and performance, sleep disturbances and fatigue, physical symptoms like headaches, muscles tension, and digestive issues, comorbid mental health conditions, social isolation and loneliness, and even decreased quality of life. Research shows that women are more likely to experience GAD than men, and it often co-occurs with other mental health conditions. However, there is hope. Cognitive behavioral therapy, known as CBT, and medication have been shown to be effective treatments for GAD. But it's not just about treating the symptoms, it's about addressing the underlying issues. And the World Health Organization emphasizes that mental health disorders, including GAD, require increased attention and resources. Now we are done. Look at how this stress went from that to this. Isn't it beautiful? I must say I'm quite emotional seeing the transformation. You know, someone out there struggling with GAD might think it's over and there's no way they can ever get back on their feet and recover. Just like how I fixed this already torn dress. But I want you to know that healing is a process, just like mending this dress. It took time, patience, and care. There were even moments when I got hurt, like when I pricked my finger with the needle. But I didn't give up. I waited, and I cared for my wound. And I continued. If anyone is ever going to overcome their struggles, they must be ready to go through a lot. It's not easy, but it's worth it. And you know what? You don't have to do it alone. Reach out to a therapist, counselor, or mental health professional near you. They can provide guidance, support, and care to help you navigate your journey. Do not be afraid to reach out. Practice self-care and stress management techniques. Connect with others who understand what you're going through. Trust me, having someone who understands and cares can make all the difference. So go out and show more love. Since you now know what GAD means, tell them it's not over and everyone can recover, irrespective of what they're going through. Share your story, share your hope, and share love. GAD is a treatable condition. Sometimes people with anxiety don't get help because they don't realize it's a treatable condition. But here you are, listening and watching this video. Do you mind sharing this video with that special person or someone you think might need to see this? Let's spread love, hope, and healing together and break the stigma around mental health. Remember, you are not alone and there is hope. Take the first step towards healing today. You're loved, you're strong, and you can overcome. And remember, healing is just a step away.